Welcome to the March Spotlight on Employee Benefits, brought to you by ProducersWeb.com. I'm Paul Wilson, and in this broadcast we'll cover some of this topic's biggest trends and most insightful research. This Spotlight on Employee Benefits is sponsored by Colonial Life, helping you help your business. For more information, please visit coloniallife.com. Workers in the U.S. are more confident about having adequate savings for retirement, even as the percentage of savers has declined, according to the Employee Benefit Research Institute, or EBRI. A survey released recently by EBRI found that the percentage of workers who said they were very confident about having enough money for retirement was 16%, up from the two-decade low of 13% recorded in 2009. Meanwhile, 60% of workers said they are currently saving for retirement, down from 65% in 2009. According to Jack Vanderhee, research director for EBRI and one of the authors of the report, some employers chose to temporarily suspend company matches to 401k retirement plans last year, lowering employees' incentive to save. He added that once the matches are reinstituted, workers will begin to save at a higher level again. Not surprisingly, a growing number of Americans are worried about finding affordable health care. 51% of workers said they are not confident about being able to pay for medical expenses, up from 44% in 2009. While 61% are not confident about paying for long-term care expenses, compared with 56% in 2009. Groundbreaking research examining medication, management, healthcare delivery, and outcomes, and new opportunities for health maintenance organizations to engage in comparative effectiveness research will be presented at this month's HMO Research Network, or HMORN, 16th Annual Conference, Emerging Frontiers in Healthcare Research and Delivery. HMORN will bring together researchers from 16 large not-for-profit healthcare delivery systems from around the country March 21st through 24th at the Hyatt Regency Austin. Scott & White Healthcare is the host of this year's conference, while the Scott & White Health Plan is the official HMORN member organization. Quote, "This year's HMORN meeting will address issues of critical importance to the national healthcare industry. The research presented will address a broad range of topics from mammography screenings to wellness in the workplace, demonstrating our broad scope of concern within the industry," unquote, said meeting chair Alan D. Stevens, Ph.D., Scott & White. Among the featured speakers is J. James Rohack, M.D., president of the American Medical Association, who will open the meeting with a discussion on healthcare reform and the need for collaboration between researchers and providers. The frequency of workers' compensation insurance injury claims has diminished in frequency, but the medical cost of such claims has risen sharply, according to a survey by medical testing firm One Call Medical, or OCM. OCM surveyed a group of managers, examiners, and nurse case managers to identify key challenges in the workers' comp industry. The study revealed that the top concerns for the industry heading into 2010 were controlling medical costs and outcomes. Specifically, respondents cited a decrease in claims frequency, but a significant increase in the medical cost component of claims, which are increasing at twice the rate of general inflation. Meanwhile, all levels of workers' compensation professionals remain under tremendous pressure to demonstrate a high level of performance, the survey said. I'm Paul Wilson, and thanks for watching the Spotlight on Employee Benefits. To see more video spotlights on your favorite products and practices, find them on ProducersWeb.com and browse by topic.